We are going to discuss what to expect during your total joint replacement and give you some helpful hints to prepare for surgery. On the right, you can see a normal knee joint. The smooth white surface is cartilage and there is space between the bone surfaces. This allows the joint to move smoothly. On the left, you can see the reddened areas where the cartilage has worn and broken down, and the space between the bones is smaller. This is the bone-on-bone pain you may be experiencing. On the left, you can see a normal hip joint. It is a ball and socket joint where the ball should roll smoothly within the socket. The smooth pink surface is cartilage and there is space between the bone surfaces. On the right, you can see the pitted areas where the cartilage has worn and broken down, and the space between the bones is smaller. This is the bone-on-bone pain you may be experiencing. You can now see the total knee replacement components in place. The ends of each of the bones, the thigh bone, which is called the femur, and the shin bone, or the tibia, are shaved and prepared for the placements of the components. There is shaving, cutting, and drilling done during the surgery to allow for the best results. Trial components are used first to be sure of the ideal fit, then they are removed and the permanent components are placed. Notice that there is a component on the end of each bone and a plastic spacer between the two. You can now see the total hip replacement components in place. The ball end of the thigh bone, the femur, has been removed and the ball component with the stem has been placed. The stem is inserted into the center of the femur. The center of this long bone is spongy, so it can be pressed down into place after some shaping of that center space. There is also a cup component that lines the socket so that both pieces move smoothly together. Just as in the knee replacement, trial components are used first to be sure of the ideal fit. Then they are removed and these permanent components are placed. It is important to remember that this is an elective procedure. We would like you to start preparing for your surgery before it happens, and we'll give you some helpful hints and tips for creating a plan right now. If you have questions regarding this, please reach out to our team. Please be sure to keep all of your preoperative appointments. The hospital has set guidelines for when your appointments need to occur. Our surgical schedulers work hard to make these appointments. If there are any issues with them, you need to contact them right away. We have goals in place to help patients have a successful experience. Our goal is for every patient to return home with Visiting Nurse Association services. The average length of stay in the hospital is about 1 to 2 days after your surgery. Patients then receive home VNA for a few weeks, and they may transition to outpatient physical therapy. Occasionally, patients may not need VNA and can go directly to outpatient physical therapy, but this will be addressed on a case-by-case basis. There are multiple steps you can take before your surgery to prepare your home for your recovery. Throw rugs that easily move around create a fall hazard. We recommend removing these from your home before surgery. Also remove cluttered objects that are easily knocked over and create a tripping hazard. Make sure your house is neat and tidy before surgery. You will not feel like doing any heavy-duty cleaning after surgery. Make sure you have enough room to walk with a walker or crutches safely around your home. Some people prepare freezer meals that they can easily heat up post-operatively for dinner. Case managers are nurses who play a vital role in your discharge plan. They will help link you to services like the VNA. They will also reconnect you to services you may already have in place. Our goal is to create the most appropriate discharge plan for you. Case management works with you, your surgical team, the nursing staff, and the rehabilitation team in your family. About a week before your surgery, you will receive a phone call from one of the case managers. They will ask about your living situation and support network. They will begin the discussion about discharge planning and answer any questions you may have. The next time you see the case manager will be in the hospital the day after your surgery. Everyone's insurance is a little bit different. For this reason, if you have specific questions, we recommend you call your insurance. Most insurances will cover therapy services at home. Insurances sometimes have a copay for medical equipment such as a rolling walker that you may use after surgery. If you have received a rolling walker, crutches, or cane in the past 5 years, your insurance may not cover an additional assistive device. If this were the case, you would need to pay out of pocket for it or borrow one from a friend. Some equipment, such as a commode or a hip kit, may not be covered by insurance at all. Case management is committed to arranging the most appropriate discharge plan for you. Case management is available 7 days a week from 7:30 until 4 p.m. If you need to speak to them while you are in the hospital, please ask your nurse to contact the case manager. If you have questions between now and your surgery, here is the number for you to call.